My name is Dr. Kristin Joy Carruthers. I am a licensed clinical psychologist at the Child Mind Institute in New York. So I specialize in the treatment and diagnosis of ADHD and behavior disorders. I work with parents and children and teachers, but predominantly work with parents and teachers to help them find ways to support kids in school and home settings. When I'm working with parents and teachers, my main goal is to get them to kind of change the way they typically interact with kids, because we know that there are lots of patterns of interactions that are reinforced over time that are not positive interactions. And so sometimes there are ways that parents may pick up on what kids are doing wrong and not pay as much attention to what they're doing right. And so my goal as a clinician is to get parents and teachers to see the good in kids, to see when kids are appropriate, and give them a really high level of good quality feedback when they're doing what they're supposed to be doing. When a kid is diagnosed with a learning disability, or when they notice that they are having difficulty in the classroom, is that they may either avoid classroom settings, they may avoid asking for help, or they might engage in a behavior to distract people's attention away from the fact that they're struggling. And I think it can be a really embarrassing period of time, especially if you've been told that this is an area of deficit. So if you're told you have a learning disability and that means you're not good at something, it can work on your esteem and have a really negative impact. So I think it's really important that we kind of shift that frame for kids and teenagers to let them know learning disability is about difference. It doesn't mean that you are deficient. It means that you probably have high intellect and that your academic abilities aren't where we would expect them to be based on how intelligent you are. And so it could be that there are just some tweaks we need to make in how we teach you. There are some tweaks we need to make in terms of the type of work that you get or structuring that work. And when we're able to make those adjustments, you will also succeed. The other thing I'd like kids to remember is that they've got to have some positive coping thoughts about the things that they do well. So everybody has strengths and weaknesses, okay? This area of learning disability is just an area of relative weakness for you. But what are your strengths? Let's talk about those things and how your strengths might help you bolster your area of weakness, okay? And also be open to exposing that maybe you are struggling, and be open to the ideas or the assistance that others can give you. If you're going through a rough time, if it's at school, if it's at home, I want you to know that everybody experiences rough times. And while things may seem really bad right now, they can get better. There are lots of different resources, including our website at childmind.org, if you have questions about things you may have been facing. You are not alone. You will get past this. Just keep pushing forward, and you are okay.